Okay, this is the Human Services Committee meeting for Northampton County, January 19, 2017. Our first item is courtesy of the floor. Would anyone like to address the committee? Please state your name and where you live.
My name is Deanna Durante. I'm a reporter for NBC 10. We're located in Bala Cynwyd, Montgomery County. I have questions for you all regarding Sarah Packer and her employment with the county. Are all of you familiar with what kind of caseload she had, how many children she was responsible for during her employment here, and are you investigating that?
Does anybody like to answer her question?
If I may, I think that's more of a legal issue that we shouldn't touch. I don't think anybody from council, just my opinion, I don't think anybody from council should address that unless we have advice from our solicitor.
Okay.
Any concern from any of you on the fact that she handled the county's children, and now we know today that one child from Northampton County was placed in her care as a foster mother?
Again, ma'am, just for the record, I just think it's something that our solicitor should address and not an individual from council.
But this is the committee that oversees Health and Human Services, is it not?
Correct, but seeing as how this is going to be a legal matter, I would refer all questions to our solicitor.
How about just as taxpayers or parents, community members? Do you have anything you want to say?
Unfortunately, while I'm on this side of the dais, I'm going to refrain from any comment.
So then when you walk to this side, you'll give me an interview and give me a comment?
Seeing as I'm a taxpayer in Northampton County, I can.
All right, thank you.
Okay, moving along. Update on Graysdale. Thank you.
Okay, I just want to go ahead and update everyone on what's going on with Graysdale with regards to the dashboard. I know we didn't meet, I think we didn't meet in November and December, or no, November was due. Okay, I got it. For November and December, we actually had very good census in November, but we did go down in December, and that's because of the number of deaths. If you refer to this handout, Graysdale discharges 2015 versus 2016, I basically did an analysis to break down where we were. And with regards to why we have a lower census in December, we did have a greater number of deaths in the month of December than we did in November. You know, people had passed on. They were in their 90s and some close to that. And we had 32 versus 18, which is a little bit higher. So right now we're looking at about 20 under that we're trying to play catch up with and get more residents in our referrals, which we're doing. So that's the reason for that. But what I did find interesting real quick was that if you look at number 2, home and community, we had 249 residents in 2016 versus 181 in 2015 who did go home after they received the services, which is a wonderful thing because they got the care that they needed and then they were able to go home. And in many instances, those residents do return back to Graysdale for any further rehab that they need. So that is a good thing. We also reduced our number of people going to other nursing homes from 26 in 2015 to 9 in 2016. And also hospice has also reduced as well. So just to give you a little idea, there's also an article there, if you take a look, that talks about, last quarter overall in the entire country. It clocked at the lowest level since 2005 for nursing care occupancy, averaging about 86.8% for the fourth quarter of 2016. We are at 93%, even with, the number of residents that we lost at the end of the year. So we're still doing okay with regards to that. We're fine with Medicaid reimbursement in terms of bed hole, so that's not an issue. So any other concerns about census before I move on?
I could just ask a question about the article.
Yeah.
It really doesn't delve into any of the reasons for the reduced national rate. Would you care to comment on that? Why do you think those statistics are the way they are?
Well, the thing that I didn't print out is if you go further down in that article, it says click here. It'll give you the full report. But basically, we have just seen an increase in the number of people going home with home care. We also have seen a decrease in the number of people not even going into nursing homes, going straight to home with care. They're kind of bypassing nursing homes. When I broke down, number of people who, when we had referrals, we lost about 22 people in December who went straight home, who were supposed to be referrals to the facility. So that probably would have covered, who we taken all those residents. So it's primarily that, the bundle payments that are coming in. They want to reduce the number of hospitalizations. They want people to be able to not have to go to the hospital unless absolutely necessary. And if they do, they want to discharge them right away and get them back home, because they feel that that's cheaper than going to a nursing home. And in some cases it is, but in a lot of cases it's not. It depends on the individual and what they're going through in terms of therapies.
Okay.
Yeah.
Thank you.
Sure. Anything else before I move on? Yes.
Just a quick, you had said that some of the residents went home and you expect them to come back. I'm just curious, is that considered another admission, or is that, for lack of a better term, a hiatus?
No, it's another admission.
Okay.
Okay. All right.
Mr. Werner.
You may want to tell the council, the committee, that there was a 50% reduction in the occurrences for attendance, and sick occurrences for the FMLA.
Yes. I'm going to get
Are you going to get to that?
Yeah,
Okay.
yeah, that's on page 2. That is the case, yes. All right. Just letting you know with regards, to some of the situations with finance, we have to wait to get the numbers on that. With regards to our, hold on 1 second. Okay. With regards to our overtime hours, the only overtime hours that they went down a little bit, that they were higher, were primarily our CNA hours because of our one-to-ones. But I personally looked and have followed up on the one-to-ones that we have. And when we started, had 10 one-to-ones, and we're now down to 4. And even those 4 one-to-ones are not consistently 24 hours, 7 days, because what we've done is the care plan team has met to determine where an individual can be reduced in terms of one-to-one supervision. And it's worked out very well, actually. And the residents are thriving. We haven't had any go back, so we're doing well with that, and that is saving on overtime for CNAs. Okay. And we've also reduced the amount of LPN agency costs, as you can see. That number is estimated, but it has been going down if you look over the past several months. And unless there's no other questions, I'll go on to page 2. Okay, on page 2, we did have an occurrence in December of a complaint visit. It was an individual who, when they looked at everything, they found out that out of 1 month, out of all the months, pharmacy did not go over the monthly medication regimen, because that person had moved the day that they were going to do it, so pharmacy had missed them. But we did do a plan of correction with the state that was approved to make sure that that doesn't happen again. So that was okay. Let's see. With regards to, everything is pretty similar with regards to quality measures. We did have an increase in the number of residents who needed ADLs, but we're working with the therapy company to go ahead and increase those residents who need assistance with ADLs. Pressure ulcers went up.
Can I go back?
Sure.
I didn't know we were going to move on from that. We, from the suicide attempt and our handling of that, attempted suicide, I should say, we recently got fined for that, correct?
Actually, no. We didn't get fined for that. We got fined for the other deficiencies. What they did is, I had thought that that was the case, but when you look at the letter, they did a civil money penalty on all of the deficiencies that they got, charging $500 each, which did add up to, I think it was $2,500.
Well, this is based on clinical review, facility policy, facility documentation. It says that the facility also failed to thoroughly investigate the circumstances of an incident of self-harm for one resident, and that resident R370. I thought that was the nucleus of that. I understand it was a couple $500 segments, but I thought that was the gem or the root of that problem.
Actually, that's what I had thought also, but it turns out that it was all of them combined. It's the state pretty much saying, now we are going to make good on the civil money penalties and charge for all the deficiencies that you have.
What about, so that doesn't terribly make sense to me, but I'm not saying you're wrong. Sometimes things don't make sense that come down with. But how about that statement? The facility also failed to investigate the circumstances of an incident of self-harm. Is that true?
Well, that is what was indicated in the deficiency. Yes.
Okay. That is a little bit different than I recalled back in the fall when we talked about this. Okay.
You satisfied?
I think I'll take this offline with Mr. Soto.
Okay.
Very well.
Okay. Do you mind if I move on?
Please.
Is that all right? Okay. All right. So just getting to our satisfaction survey, where our benchmark is a 3, we're at 4.21. We ended the year with regards to satisfaction for residents and for families. The FMLA that you had said, that 50% reduction with regards to call-outs, which is great. And the turnover rate, for the most part, the only turnover rate that went up was our RNs, which didn't. Those employees, did move on to other positions and other life-changing events. And our star rating remains the same in December. Yes.
Do you anticipate that may change? The star rating?
Yes.
Okay. Have you been in contact with anybody? Because I did see that we got a letter from the State Department of Health, and I saw that there was a corrective action in place and that we got a fine. Do you intend to appeal that fine?
No, because those fines were, we accepted those deficiencies and they were correct, and we did have plans of correction, so in that situation, that's the result of the plan of correction of
Okay.
giving them. Yeah.
Ms. Phelps.
That is the item I was talking about, correct? They're one and the same, they're not an additional one.
What's one and the same?
Well, Seth, you brought up the fine and the corrective action and what was written up in the state.
That was from the suicide attempt.
That's right. That's my
Right.
take. It's all one and the same, because I don't want to get. I almost got the impression that I was talking about one thing and you were talking about another. I think we were both talking about the same thing.
You are.
Yeah.
Yeah, that is one and the same. What I didn't understand, and please excuse me, is that I thought you were saying that fine was just for that one deficiency when it's actually for all of them combined. I'll talk to you about
Yeah,
that.
there's something there I'm missing. But
Yeah, or I can go over the letter with you because it breaks it down like on the bottom.
yeah, I have a copy of the letter here.
Oh,
like
okay.
that. Yeah. Okay.
Please.
All right. That's all I have, unless you have any other questions.
Okay.
Oh, whoa.
Sorry.
We've come to the end of the year, and I guess at this point, do you have any idea what the bottom line is going to be for when we close the books in a couple weeks on 2016? Are you able to?
Okay.
Are you able to
I'll take
project
this
where
one,
we
yes.
might stand?
We have our crystal ball, and actually, I think we'll know very specifically by tomorrow. We looked at some preliminary numbers early this afternoon, and if things hold, and we're still trying to fine tune a couple of things, and the comment I'm going to make is subject to change based on final.
The audit report.
We know with the way revenues come in and some things like that, but we're anticipating that the facility should end up about just shy of $800,000 in the black for 2016, based on some accruals. We thought it might have been higher, but there were some accruals we had to take at the end of the year that pared that back. Minimally, we would expect maybe around $500,000 if some of the adjustments we have to make come through in a negative fashion. So about $500,000. That is with the intergovernmental transfer funds of $2.4 million that we received. So without that transfer, we would have been in the negative somewhere around $1.8 to $2 million. But fortunately for the additional funding that came in, we expect to finish in the black. The follow-up question would be, does that include the bed sales? No, it does not. I made the decision with fiscal because we really felt that Grace was going to finish somewhere between $500,000 and $1.5 million in the black, that we put those funds back to where they were originally, historically when we budgeted the revenue originally, we went back to that line item and kind of reversed that and credited the Human Services group with that money. So it is remaining within Human Services, but not specifically to the Graysdale revenue line with that. It's one-time revenue anyway, so that's where we are for 2016.
If I could throw you a high-hanging curveball, then.
Please.
What was the situation when you took office, and to what do you attribute the number that you've just given us this evening, aside from the IGT?
I'm going to make two qualifying statements in both when we go back to 2014 and even with the $800,000 finishing in the black. That doesn't include capital, okay? And the county made a decision years ago because the amount of capital we would allocate and use in a given year caused the budget to fluctuate. We removed that from the budget. If we include capital and do a full P&L, I think we're averaging between $1.5 to $2 million a year of capital going to the facility. So if you add that in, we'd actually still be in the red. But operationally, we're in the black. So I just want to add that little bit of a qualifier. We do track capital as a completely independent in our financial records. So with that, in 2014, the number was about $6.7 million. Was the operating loss that the facility encountered. The changes that have been made, obviously, we'll start most current and work back. The IGT, the additional funding of $2.4 million last year, I believe we're anticipating, again, that to continue this year, 1.8 to around 2.4. If you remove that from the equation, it's really been, we've systematically gone through the facility and really looked at all the business processes of how we run the facility. Everything from the business office in terms of when we first meet and greet potential families that want to have their loved ones come there as residents, how we process that. To the back end, what are we doing about receivables? Are we collecting our revenue in the year that we're actually incurring it? We had issues when we first came in back in 2014. We'd have several $1 million hanging out there that just kind of rolled forward that we would collect sometime 6 months later. So the whole team has done a great job of collapsing that. We've invested in technology. We upgraded the pharmacy. We invested in electronic health records. We brought in systems like Kronos, which helped us with our scheduling. Ray mentioned call-offs and those types of things, which we account for a couple $1 million a year. So systematically, we've gone through the entire system, made changes that incrementally, when you put it together, has helped us collect revenue in the year. When we came in, I think census, when we came in early in 14, in February, we hit the hot water issue, which really collapsed our ability to maintain census of about 620 beds. In 2016, the average was 667 beds, I think. Is that right? 667 was our average, and we had a bad month in there, so we were able to maintain that. We budget off of about 660 beds, so that gave us a 7-bed cushion in 2016. So from 14 through the end of 2016, we actually were able to ramp fairly rapidly. It took about a year to get us up to that level. And then for the 18 months, we've actually been able to maintain that census, which allowed us to maximize really the revenue collection. So all those coming together have allowed us to put the performance in 2016 together for the facility. And there isn't an entity within the facility that can't lay claim. Everything from nursing to the LPN staff, to housekeeping, to the O&M. Definitely the Stan's group has done a phenomenal job. Kathy Allen has spent a copious amount of time there helping to steward that, Sue Edwards and the whole team there. So it really is a collective effort to make it happen. So it's quite an achievement, to have made that reversal. The challenge going forward, and I don't want to be the bearer of bad news, but I will prognosticate a little bit. Part of what we'll be doing with Graysdale for 2017, so I want to kind of point to 17 and forward. One of the challenges is going to be, can we maintain that bed count? The marketplace in that same intervening amount of time has dramatically shifted in terms of the competition, if you would. So while we've had the luxury of being a county-owned facility, the marketplace we're competing in has actually heated up significantly, and there are a number of players out there that are competing for the same residents, if you would, going forward. So as we look at what else do we need to do, how do we need to shift in how we approach the marketplace, the ACOs, as they're referred to, which is St. Luke's and LVHN and so on and so forth, that are a large feeder system, if you would, for potential residents. We have to perform for them, and they have very specific criteria that we're looking at. So there are a number of changes that are coming through that we need to, again, I'll say we spent the last 3 years getting square with the facility, and we've done a great job. But at the same time, and I think we did point to this a little bit, the marketplace is rapidly changing, and I'm even amazed at the speed with which, under the umbrella of healthcare, and we've seen what's happened with healthcare, the competitive nature of the nursing and rehabilitation facility overall has really changed dramatically. So we met this week. We'll be looking at strategically what do we have to do anything different? Where else do we need to pick up our game, if you would? And there are some more improvements that we can make. But I'll say in 2016 we've kind of reached a plateau revenue-wise. Going forward, I'm not seeing the reimbursements coming from the state and the federal government to be going up. If anything, they're going to get tighter. Our costs continue to increase. We've been able to, fortunately, over the 3 years, we've been able to achieve this performance while still increasing costs. So we've been able to offset the employee costs, benefit costs, and those inherent costs of just doing business that go up every year that we have no control over. We've been able to absorb those to a point. I'm going to point to 2017 and say it's going to be a real test for us to maintain that, definitely as we look to 18. And then there's some significant changes in terms of the community health choices that come into effect in 1/1/19, and we have no insight into what that impact could be financially for the facility. So I don't want to be a dark cloud. I think we should celebrate everything we've done at Graysdale. It's quite an achievement for us to have done that. At the same time, I just want to let you know we have more work to do in order to maintain the performance that we've been able to achieve so far at that facility.
I'll just follow up. One of the complaints over the years was when we did have surpluses that we failed to reinvest. So I guess going forward, you mentioned about $800,000. How do you plan to reinvest that in the facility?
Well, as is required per, I believe,
Yep.
the ordinance that is on the books, that money will roll forward as a positive balance for Graysdale. The challenge, and this shouldn't be lost, and I've used the term, it's still a fragile entity. If we have any experience of, say, we go through a quarter of where we lose 20 beds that we can't fill for a particular reason, whether a structural reason or some reason we can't fill, that accounts almost $2 million. We just ate up that surplus and have made it harder for us to actually achieve the financial goals that we want. So I just want to raise the fact that it is still a system that with the slightest bump, we lose a few beds. It's a direct dollar impact on the ability to generate the revenue that we've achieved in 2016 with that going forward. So.
Yeah, either way, I think it's a significant achievement. I'd like to thank yourself and Premier for the job you've done. As someone that's been sitting here looking at those numbers for a long time, this is a day I wasn't sure that I'd see. So congratulations to you both.
I will tell you the same thing. I've been very conservative in wanting to say that we'd end up in the black if it weren't for the work on the IGT and that money coming in. And there's a lot of people watching that have allowed this to happen now. My message to the facility when we start to meet with them over the next several weeks is, we have to up it even more. And the marketplace itself is not going to allow us to rest on our laurels, I guess is really the message that I'm delivering. And we're beginning to put a strategy together that we'll implement in 17 and hopefully we'll have the same conversation in January of 18. Any other specifics on the facility?
I think we're going to agree tonight that Graysdale's in the black. We're going to.
Yeah,
Okay.
there's as I said, you can right now I'll use 800,000 as a benchmark number. I don't think it'll be probably below 400,000 or 500,000 at a minimum. If some of the adjustments we have to make come through, it could bump up slightly higher.
Okay.
But that's the range. So we're confident it's in the black, and we'll take that. We'll take that for the moment.
Okay.
The bed sales, the bed sales, and any surplus, both those monies will go in dedicated to Graysdale, correct?
No.
As per the.
No, the surplus is per the ordinance will roll in the actual budget item for Graysdale, so it'll show a positive balance of approximately 800,000 when we close the books. The bed sale itself, those dollars came out of a human service line item where the original revenue was booked back in 13 or 12 or 13 when it was anticipated we'd get this done. Based on the direction of our independent auditors, it was recommended that that money should go back to, since that line item was already created, it should go back to the human service. So it's it's within Allison's budget, the human services overall. It's not specifically given to Graysdale.
And I get that, but almost like a gentleman's agreement. I understand why it had to go back to where it came from, but my idea, and I think a lot of people's idea, is that both the surplus and the Graysdale, don't worry mechanically where they rest, is that money is going to be reinvested in.
Well, it's a philosophical conversation that we're having because when we sat down and say, all right, well, John, what would you do if I gave you an extra $800,000? Right, that's what you're saying. We want that $800,000. I don't know off the top. I apologize, but we budgeted something like 1.6, 1.8 million in capital projects for Graysdale, and we did similar last year. So if you want, you can put a line item in and take 800,000 out of capital and go, there you go. The capital number that we put in was based on what we believe the Public Works Department could achieve and actually get done within the current year. So if I gave them an extra 800,000, I want you to do 8 more projects, they're not likely to get done. So it's not a matter of challenging the finances in order to move things forward at Greystone. We're funding it fully to our ability to deliver. So it's kind of a philosophical conversation
I guess
ultimately.
I wouldn't want to see that money spent elsewhere in the general expense of the county and not be accounted for later on when we need, for a facility that may have $9 million worth of repairs. And I understand that you're looking at it in regards to the capacity of the county to actually do the work. In other words, so money almost is not the issue, it's the capacity
To deliver on the
to
monies that
deliver.
are spent,
And
right.
I totally understand that. But what I'm thinking of is I wouldn't want somewhere down the line us to look at property tax revenue to do something without first going back after that money that has been
Okay, I mean,
earned from
yeah,
Greystone.
that's again, if we cross that bridge and we need to have that conversation, we can. Right now I'm not anticipating that requirement. And how long would you hold on to that money into the future? Again, my approach has been to fund what we can do. The rest of the money needs to be put to work, if you would. But it is the commitment I will make at least this point, and we can discuss it further, Mr. Phillips. Is it's within the human services umbrella, so it'll remain in the caregiving, if you would, that group is charged with. Overall, I can't specifically say it's going to go to Greystone. Like I said, that's an accounting adjustment. You want to put an amendment in, fine, we'll move 800 in, but I would go, well, now I'll have to move 800 out because we don't need it in the moment, if you would. The county contribution that the county has made, and we use county contribution, I'll say operating loss, taxpayer dollars have been, so I'm not actually going to go and say, well, we have to hang on to the bed sale for taxpayer purposes. Well, taxpayers have been funding the operating loss for the last, X number of years, and that number is actually quite large, tens of millions, several millions of dollars. So that's why I'm not concerned about it. If there is something specific that this body would like to do for Greystone to the tune of that money, I'm open to. We have the dialogue about it.
Okay.
I don't want to get too parochial about it, but that's been the approach I've taken with fiscal, and that was a decision I made mid-December where the money should go based on where we thought Greystone would finish.
If I may. I think we'll try to. I think we should talk about that and tag that money. Greystone has many years ago had contributed to the county, had many times gone back into the budget for over a 10. I think Duran always qualifies it. I say 10 million, he says 8, whatever it is. And I think we should discuss the potential for putting that money or tagging it somehow for Greystone, just for the main reason that if something would happen, which we're anticipating at the old facilities, if it's a $200,000 bill, $150,000, that we know we have the capability to take care of that. So I'm sure you're open to that, but that's already been.
If you want to, we can sit down and work through that. We don't need to take up the whole body's time to do that. I'm happy to have that conversation with you, Mr. Warner, Mr. Phillips. Any other questions on Greystone?
No, as a matter of fact, now that we have you here, I thought Allison was going to be here, and I was hoping Allison might be here.
I'm not sure. She's still on the mend from her broken leg and surgery that she had.
Oh, okay.
So, is there something else we can address for you, Mr. Vaughn?
I've gotten a lot of calls personally about this case, obviously, that everyone is aware of, and it does affect the Human Services Division. And I just wondered if the county had a statement about this particular case.
I will read this statement that was actually sent out as a press release earlier this afternoon on the particular matter, and I'll provide you a copy when I'm finished. I assume council was copied on that press release. I apologize if you were not.
We did not get that.
The following is provided by the Northampton County Department of Human Services Children and Youth Family Division in response to inquiries regarding Sarah Packer. I assume that's the case you're referring to.
I think we're all
Okay, I just, for the
understanding
record.
it. Yeah,
Sarah Packer was employed by the Northampton County Department of Human Services Children, Youth, and Families Division. She began as a caseworker in January 2003 and became an adoption supervisor in July 2007. On January 20th, 2010, Ms. Packer was suspended from her employment without pay. At or near that time, a criminal investigation was taking place in Lehigh County. Ms. Packer did not return to the Children, Youth, and Families Division. Her employment was officially terminated on April 15, 2010. At no time during the course of her employment with the Children, Youth, and Families Division did Ms. Packer serve as a foster parent for any Northampton County dependent juveniles. Ms. Packer did serve as a foster parent for one Northampton County dependent juvenile from 2000 to 2001, which was prior to her employment with the county. The individual is now over the age of 21. Northampton County's Children, Youth, and Families Division was not the intermediary for the adoption involving Grace Parker. After the horrific circumstances surrounding Grace Packer's death became known, questions were posed to Northampton County, as well as many other entities. Northampton County's Children, Youth, and Family Division is bound by a strict confidentiality statutes and regulations which preclude the release of detailed information concerning this matter. Moreover, the agency cannot engage in conduct which would compromise criminal investigations or assessments being conducted by other entities. Information can be provided as to the structure and process that are in place. At the time of Ms. Packer's employment with the county, at the time of her termination, and through to the present, Northampton County's Children, Youth, and Family Division has been subject to oversight by the Pennsylvania Department of Human Services. The county agency has and will continue to cooperate and comply with the Commonwealth agency's direction in all matters. This includes any record reviews and or production of information requested by the Commonwealth agency. Whenever a child dies in Pennsylvania, the Pennsylvania Department of Human Services has the authority to assess the circumstances that caused or contributed to the child's death. A particular process is in place for such an assessment. The county agency is required to cooperate with such assessments. The results of the Commonwealth agency's assessment are ultimately made public. This particular tragedy has drawn public attention to the employees of our Children, Youth, and Families Division. The alleged actions of Ms. Packer are contrary to the mission of our county agency and its dedicated workers. Typically, these people do not receive enough positive attention or appreciation for the monumental work that they do. These individuals devote their lives to the safety and well-being of children. On a daily basis, they go willingly into situations that would make most people feel uncomfortable, repulsed, or even frightened. They do their job that very few people have the guts to do in order to keep children safe. There's no greater contribution to our society, and these workers deserve our gratitude.
well, thank you very much, Mr. Brown. I'm glad that we had that on record. You will keep us abreast onto the investigation, is that correct, as the process?
As information is permitted to be shared, we will share that. As the statement says, there are significant regulatory privacy and statutory matters that prevent us from sharing information.
Sure.
But we will share what is possible.
Appreciate that. Thank you. Anyone have any questions? Okay, moving along. Report on Drug and Alcohol Division.
Good evening. I'm Tiffany Rosnes. For anybody who doesn't know me, I'm the administrator of Drug and Alcohol. And Allison asked me to come and talk to you about what's going on in drug and alcohol right now. And I gave everybody a copy of just some bullet points, some charts, and some facts and figures. Obviously, the main thing that we are focusing on, a lot of our efforts, including prevention, treatment, and recovery supports, revolves around the heroin crisis. In Northampton County, last year there were 79 overdose deaths, and the coroner stated that a majority of them were heroin related. He can't say for sure. Some may have been multiple substances. Also, what is happening at the state is they're charging us with the task of reporting overdose, not just, well, a lot of what is reported is the deaths, but those who survive and what happens to them when they're taken to the hospital, when they're revived by EMS. So we're working very closely with the local hospitals to try to gather that data, to try to bridge the gap, because sometimes a patient will come into the emergency department, they'll be stabilized, they'll say we don't want services, and then they're on their way. And we lose the opportunity to talk to them about treatment, what options there are out there. So we have been working very closely with the local hospitals. They've been very receptive to programming, and as of July 1st, we started offering on-call assessments on the weekends. The hospital can call us, say we have someone here who's overdosed. We'll send an assessor out within 30 minutes, assess them. If they need treatment, we'll work to find them a bed. If no beds are available, we'll connect them to our certified recovery specialist, and then they'll monitor them all weekend until our case managers are back in on Monday. So that's just one example of something that we're doing. Prevention-wise, we've expanded different programming that's in the community. You may have heard of HOPE. It's the Heroin Opioid Prevention Education Program. And for this year, what they've done is they've added Northampton County residents. So it's not only are they talking to you about what is an overdose and what is heroin and how can you get help, but they actually have parents and individuals who are in recovery, parents of children who have lost their life to this disease. And they'll actually speak on video, but they speak in person. And it gives the parents, the kids, the ability to ask questions and to see firsthand that addiction is not, it doesn't discriminate. It's not based on one race, one gender. It can happen to anybody. So we're excited that Northampton County is more involved in that program and that we're out there. We started having mock bedrooms in the different high schools. We had one at the Human Service Building. You can come walk through, and it teaches parents different things that are going on, things you wouldn't even think, what's hidden behind a poster where kids are hiding drugs, paraphernalia they're using. So we really want to focus on educating the public, educating the kids, obviously treatment. But another thing we want to focus on is recovery. You can put someone through treatment, but what do you do for them afterwards? So on July 1st, we opened our 4th recovery center in Northampton County. It's in Easton on 3rd Street. It's called A Change on 3rd. And what it does is it's a sober environment. So they have 12-step programs, activities. They have a Super Bowl party coming up. They'll have karaoke night, yoga. You can come there, use computers to look for jobs. They have peer recovery specialists throughout. But we want to have a place where people feel safe, where people who are just learning how to be back in their community can say, okay, I can go here, I can identify with people, I can get the support I need. Not many counties have even one recovery center, so to have 4, I think is a great accomplishment for Northampton County. Just some other points I make in here. I talk about our drug court, and that we hit 1 year in April. We're coming up on our 2nd year. Currently, we have 32 participants. We have 6 pending. The pending list seems to be growing every week, which is great. And we've had 2 graduates. So we're really excited by that. We have a 3rd who is preparing for her graduation. And we're just kind of figuring out the program, figuring out the process, adjusting as we need to.
Can you educate us briefly on the program?
Sure.
so to speak.
Okay, so the drug court is a little different from mental health court. The drug court is a post-sentencing program. So ours everybody involved is a parole or probation violator. So what happens is when they're picked up for a violation, obviously they have the option to plead and take the punishment that comes with it. Or if they're a candidate, they're interested in drug court, what they do is make application. They're invited to come over. A lot of times we have people observing from the prison. They're brought over. And they're assessed in the prison. The treatment team, which is made up of providers, probation, mental health, the public defender's office, obviously Judge Daly is our main judge. We sit down, we review the case. What we're looking for is individuals that we think the program's a good fit for. We look at their backgrounds, we look at their essay of them telling us why do they want to be in this program. The program's designed for them. We're there to support, but they really need to do the work. And so once we assess, and if the team feels they're appropriate, they'll be brought out in front of the judge, admitted to drug court, and then they're put into whatever level of care is determined. Typically, I'd say almost 99% are going to inpatient. So we'll locate a bed. They'll go right from jail to the facility. So we don't want them back out on the street. We want to just have that smooth transition. While they're in inpatient, we check in on them as case managers in the SCA every week, get an update how they're doing. If there's any issues, behavioral issues, they get a little talking to from us or probation. Then Judge Daly will call them. Typically, he'll maybe call them every other week while they're in a facility. We call them definitely closer to discharge because what we have to plan for is, are they coming home? Some go to a halfway house, which is a step-down level of care, where they have a little more freedom, but they're still living in a facility and getting treatment. Some can go home. They have an appropriate placement, so they'll come home and then they start their outpatient treatment. They're connected to a certified recovery specialist who helps them navigate medical appointments, how to ride a bus, how to get a GED, medical assistance. We work them through that, how to get employment. And then what they do in the program is we're on a phase system, so there's 4 phases. In phase 1, you come every week. You come in front of the judge. He'll go over how are you doing, how are things going. If they need some correction, they can be sanctioned. If they're doing well, they get incentives. And then as we go along, then we progress them through the phases. Obviously, once they hit phase 4, we're talking graduation. But they go through their treatment, so we monitor treatment. When they're out of treatment, we make sure they're urine screened. We've had people who have relapsed. It's the nature of the disease. We'll reassess. We'll look at what's in place. What else do we need to add? And get them the services that they need. But they get a very comprehensive set of supports. And it's been really great. The 2 that graduated, these are 2 people that went through this program. I think they're about 18 months, not 1 sanction. That's pretty amazing because we have some that maybe every week need a little talking to from Judge Daly. But they've gone on. They have, one has a child. They're working. They got their GEDs. They have their own apartments. We'll help them find housing if they need it. We just we're there to support, and as they get closer to the end, they're doing most of it on their own, and we're just kind of checking in. And then once they finish, they're graduated. If their probation is completed, they're done there. And before they graduate, they also have to pay off their fines and costs. So we help them budget and do all that. So it's a very comprehensive program. The difference from that in mental health court is in mental health court, when they graduate, their charges are removed. We don't have that at this point. We're not diversionary.
This is excellent, and thank you for being here tonight to explain all this. I just have one question, and it concerns the funding. The potential appeal of the Affordable Care Act, okay, for dismembering of the Medicaid program, how big of an impact on Northampton County would that have on the funding itself, the SCA funding?
I don't have numbers, but I can tell you that we went, when the Medicaid expansion came out, everybody started getting picked up for services that we were always paying for. It was a huge shift. It freed up money for us to do other things other than treatment. So now, when we're at a place where we're funding other things and we're doing stuff, we could see potentially a lot of them, if it's repealed, going back to not being eligible, and then the county takes over funding services if they're not MA eligible or if their insurance doesn't fund it. So it's something we're watching closely, because that could mean we have more clients coming to us that we got to take on. There's always the talk of, allocations being cut in the future. We haven't heard anything definitely. So there's a lot of things up in the air financially that we are keeping an eye on, but, we're committed to providing the best services we can.
Okay, thank you.
Are y'all finished?
I can answer any other questions you have if
Okay.
there's anything else. It's pretty, set out here.
Does anybody else have any questions? Mr. Kuzic?
Yeah, just the state budget, how has that impacted you last year, and what do you expect this year?
Last year, the impact, we were fortunate that the county continued providing the funding for services. So some of my counterparts in other counties had to lay people off, had to cut services, had to cut back on what we were provide. We were able to stay up and running at full capacity, which was great. We have not seen a cut in our allocation, and the Medicaid expansion with that just kept us going. So at this point, we haven't had, knock on wood, too much of an impact on that end, but like I said, the upcoming things that are coming up being talked about, we're just keeping a close eye on it.
Yeah, I know the governor had a press conference and is investing in some of these programs, and I think it's a good thing. So I'm hopeful that your program will see some increased funding in the state budget. And when the Affordable Care Act is replaced, I'm hopeful that this sort of treatment will be covered.
Does anyone have any comment, Mr. Kraft? Oh. Okay. Okay, thank you, Tiffany.
Thank you.
Appreciate your time.
Thank you.
If there's anything else for the committee? No? Motion to adjourn? Second? Thank you.
This time, yeah.